Welcome to World Sexual Health Day 2025. Happy World Sexual Health Day. What a wonderful day we are celebrating today. Hello, my name is Renee de Klerk and I'm the Executive Director of WAS. I am speaking to you today from the beautiful city of Porto. Please make use of the chat box and tell me where you are today. Please chat to us in the chat box throughout. I am here for just a few minutes to welcome you all and to give you just a few house rules for our official World Sexual Health Day webinar. Of course, the theme for this year's World Sexual Health Day, sexual justice, what can we do? And this is exactly what our experts are going to talk about today. We will ask ourselves the question, what can we all do? Before we begin, just the housekeeping notes. This session is being recorded and will be available for replay. Live translation is available in multiple languages, and you can select your preferred language using the interpretation button. We encourage questions. Please type them into the chat or, even better, the anonymous Q&A box, and our team will moderate them anonymously. Use the chat to engage with us, but please keep your comments respectful and on the topic. I am now going to hand over to our new president, which you all met in our previous webinar, our president, Faisal Al-Kak from Lebanon, but who is also here in Porto today with me celebrating World Sexual Health Day. Faisal.
Thank you, Renee, and welcome everyone from the different corners, regions, countries in the world. And happy World Sexual Health Day for everyone. Distinguished colleagues, friends, and partners from around the world. It's my great pleasure as the president of the World Association for Sexual Health to welcome you to this year's official World Sexual Health Day celebration in the presence of excellent and known friends, experts, and colleagues from different parts of the world, from Brazil, from Canada, from Bangladesh, from Mexico, from France. Each year, the World Sexual Health Day reminds us that sexual health is not only about medicine or education, it's also about human dignity, it's about equity, and it's about rights, and also it's about justice. And every time we talk about justice, I cannot but remember the famous quote of Martin Luther King, that injustice anywhere is a threat to justice everywhere. Our theme this year is sexual justice and why now couldn't be more timely, because around the world, we continue to face growing inequalities in access to services, in protection of rights, and in recognition of diverse identities and experiences. Too often, stigma, discrimination, and political backlash threaten the progress we and others have made so far. By placing justice at the center, like we're doing in this celebration today, and other celebrations that will follow, we are contributing to the rights perspective, and we're advancing a transformative vision, one that links sexual health to social justice, one that demands accountability for inequities, and one that insists that all people, regardless of gender orientation, age, or context, deserve respect, autonomy, and access to care. I want to thank Professor Alain Giami and our distinguished panelists for leading us in this important conversation. Their perspectives from research, policy, practice, and lived experiences will help us answer the urgent question, why now, and what should we do together? On this World Sexual Health Day, let us commit to action, to solidarity, and to advancing sexual justice for all. And remember that the question is not why sexual justice, but why not yet. And thanks to Alain for pushing this agenda. Every delay in justice is a denial of rights. Thank you very much, and I welcome you again to our webinar today. In that respect, I would like to welcome a friend, a colleague, and she is the outgoing chair of the World Sexual Health Day. In fact, yes, we have a committee for this, and she has led this committee into higher levels and places. Lynn Barkley, Lynn, since June of 2006, as I said, has led also the American Sexual Health Association as its 10th president and CEO. And fortunately enough, she took the association from being a dysfunction-centered, disease-centered, into a more positive, embracing, inclusive sexual health paradigm, challenging and changing many long-held beliefs in the process. Working with experts from academia, federal governments, researchers, as well as corporate America, Lynn has led ASHA, which is the American Sexual Health Association, in the development of the framework for sexual health. She frequently represents ASHA with the media, funders, and colleague organizations and speaking about sexual health across the lifespan. I welcome Lynn, the outgoing chair, as I said, of the World Sexual Health Day Committee, to share more on the history and development of that important day. Thank you, Lynn, for being with us.
Thank you, Faisal. I am so excited to watch what you do with the World Association for Sexual Health as its newest president. So I just want to take a few minutes. It's so great to see you all. I'm delighted to be here with you to give a very brief overview of World Sexual Health Day. Yes, it's a real day, and no, it doesn't come with fireworks or cakes, but I think both would be great, to be honest. That's just my opinion. Since 2010, WAS leaders felt a pressing need for the world to speak openly about sexual health. World Sexual Health Day has carried 15 different themes to guide conversations and inspire action. The very first was Let's Talk About It, encouraging people to break the silence around sexual health. Other themes have been highlighted youth rights and education, sexual health through the life course, pleasure, consent, and positive relationships. Each theme reminds us that sexual health is more than biology. It's about respect, communication, justice, and human dignity. Together, these themes show how the day has grown from simply raising awareness into a global movement for change. Since then, World Sexual Health Day has grown every year. Today, it's recognized in more than 60 countries with events, lectures, workshops, art, and community celebrations. Some places hold public forums, others organize festivals, and many use social media to spread awareness. And that's important because sexual health is about promoting well-being, equality, and dignity for all people across all ages and all cultures. Whether it's making sure young people have accurate information, ensuring older adults feel included, or promoting respect for diverse identities and relationships, the month gives us all a chance to reflect and to act. This year's theme is sexual justice. What can we do? I'll leave the deeper dive on that to my colleagues, but I will say this. This theme reminds us that sexual health connects to some of the biggest issues of our time, from human rights to social equity to public health. So as we mark the 15th World Sexual Health Day, and really World Sexual Health Month, let's remember this is more than a date on the calendar. It's a movement. It's an opportunity to break stigma, to share knowledge, and to build a world where everyone, everywhere, can enjoy sexual health as part of overall health and well-being. And while there may not be fireworks yet, there is something even more powerful, the spark of conversation. That's how change begins, and that's why this day and this month are so important. Thank you.
Thank you very much. And I cannot but agree with you, Lynn, that it's not a day, it's a movement. And that movement keeps on evolving every year with the new themes and new challenges. And of course, it's in 60 countries. And hopefully, thanks to you, to the committee, and to us and all, and to all those attending, is going to be more themes and more countries, hopefully, in this movement. It gives me a pleasure to introduce Dr. Alain Giami. Dr. Giami is the immediate past vice president of WAS and current co-chair of the WAS Sexual Justice Initiative. Well, it is his brainchild, I would say. Dr. Giami is currently emeritus research professor at the INSERM, which is the National Institute of Health and Medical Research in Paris, France. He served as a vice president of WAS from 2021 to 25 and currently an independent researcher, speaker, and consultant. He served as an expert in various task forces at the World Health Organization, UNESCO, French Supreme Court, and the French Ministry of Health. He created and developed a university diploma on sexual health and public health at Paris University, Paris 5 and Paris 7 from 2007 to 2014, and served as scientific director at UNESCO chair in the sexual health and the human rights over 2010 to 2014. He has published several books in French, English, and Portuguese, including Histories of Sexology Between Science and Politics, and also Sexual Revolutions. Welcome, Alain, and thank you for coordinating this webinar, and thank you for being our host for today and for doing all the work to us and to the Sexual Justice Initiative.
Thank you, Faisal. Thank you for your introduction and your welcome. Thank you all the organizing team for the immense effort that they did. And thank you, the panelists, to be here. I will introduce you a little later. So welcome in the World Sexual Health Day, and I am happy that the previous administration decided and suggested to center the World Sexual Health Day on sexual justice and focus also on action. This is important because and it is important because now it's a moment of raising awareness of our colleagues and of population groups, activists, professionals on the question of justice. First, I want to remind the process of the invention and fabrication, the manufacturing of the Sexual Justice Declaration, which was a quite long process, which started in 2021 in Cape Town during the meeting of WAS. And then we had several meetings, consultations, seminars, conferences. And especially what is important is that we created, we organized a steering committee with, and I want to give a tribute to the members of the steering committee who participated, I would say, with a lot of motivation, with a lot of discussion, and who expressed the diversities of point of view and coping, managing diversity was not an easy task, and it was difficult, but we did it to find a consensus about sexual justice because the situation of injustice are so important and they are so different in the different region of the world. So this steering committee made an important work in collecting the literature, discussing data, writing draft, preparing the WAS Congress Declaration in Antalya in Turkey in 2023, and finally, I want to thank the General Assembly of WAS to have ratified the final sexual justice in Brisbane, Australia, on the 18th of June of 25, a few weeks ago, and I'm happy of that day because in France, the 18th of June has a very important meaning. It was the day in which General de Gaulle decided to start the resistance to the Nazis. So I'm very happy that we published, that we ratified that declaration on the 18th of June. And finally, we have a position paper that has been discussed by all the members of the steering committee and also by the officers and the members of the previous advisory committee, which is under discussion with a peer-reviewed journal, and I hope it's a lot of work and it will be published soon. Why now? This is the question, and I want to echo the words of and I want to echo the words of Faisal when he said, "Why not yet?" And I think this is a very powerful expression, and we could say, "Why now?" Why now? Because we are facing unprecedented attack against sexual and reproductive rights by restriction of evidence-based comprehensive sexuality education, anti-gender campaign, recent situation in the US and other countries, and threats against academic freedom, freedom of speech, and autonomous research and publication. We have, unfortunately, a lot of situation of war and armed conflict and ethnic cleansing and genocide, you can say, in Afghanistan, Darfur, Ukraine, Gaza, Palestine, Central Africa, and many others, I must say, unfortunately. And what is important to say is that in those war and conflict situations, sexual health is not the first issue of awareness, even if we know that sexual and reproductive health, and in particular the situation of pregnant women and newborn is very problematic, and we know that in the future there will be a lot of sexual issues among the people who have been mutilated by war, by bombing, and by destruction. So when we speak of sexual justice, it is a question also of that, and we need to put the idea of sexuality, sexual rights at the front page, and I would say at the top of it. So then we have other, sexual health is threatened by health crises, COVID, malaria, dengue, HIV, obesity, and mental disorder, which prejudice the sexual health. And then last but not least, the inequalities and class colonial oppression and domination, which are increasing. These situations have an impact. They do not affect. They do not affect every individual and community in the same way. So you have some people, and we know that in times of crisis, we have people who become more rich, and you have people who become more poor. And it is the same situation with sexual health. We have sexual and gender violence against women and girls. We have limitation of access to gender care for trans and gender variant adolescent and youth in countries like Western Europe, which this kind of access is threatened. Restriction and cancellation of access to abortion and contraceptive services, reduction and cancellation of funding and resources for research, and removal and restriction of books in libraries and database. This is exactly the situation that was faced by Magnus Hirschfeld in 1933 with the institute in Berlin, where the Nazis made an auto-da-fé of the library of the Institute of Sex Research in Berlin in the early 30s. The objective of the Sexual Justice Initiative, not only of the declaration, is to ensure the promotion, protection, and respect of sexual and reproductive rights. And this is important because in some places, those rights are existing and promoted, but they are not enough promoted, and they are threatened by the current situation. So this is the most global aspect, which is the enhancement of the promotion and respect and implementation of sexual rights. Then we need to reestablish equitable access to these rights by addressing, structural determinants. And it is important to say that sexual justice is not only about individual. Yes, we need to have, I would say, subjective and ideological disposition to justice and equality. But it's a question of system. It's a question of political institution. It's a question of governance. And we need to identify and fight against the structural determinants of inequality. And this is effectively, I'm happy that today and tomorrow in particular, we have the first meeting of the World Sexual Health Assembly, which mission will be to work on that particular level of governance, of organization, and all this political level. We need to on a lower level, we need to change and challenge institutional norms, representation, all those aspects which create uncomfort in the everyday life, and in particular in the access of care. We need to develop justice as a concern, as a central concern for clinicians, as part of a medical bioethic, and we know that justice, dignity, among others, and confidentiality are central in medical ethics, and we need to consider that sexologists need to endorse a code of ethics which includes dignity and justice. Then we have to redistribute and to repair, and one of the practical aspects of justice is to redistribute in favor of those who have been forgotten, in the distribution of resources and freedom. We have you can have access to the definition of sexual justice in the declaration, but I remind here a short definition of sexual justice, which as a fundamental framework for achieving equity and dismantling equalities in sexual health and rights. We need equity to ensuring that resources, services, and opportunities are allocated based on individual and community needs while maintaining equality. And I know that Bobby has a lot of important reflection about this. And we need, at last but not least, one long-term effect will be to challenge societal norms, power, values, and prejudice among institutions. So you can find the WAS Declaration on Sexual Justice on the WAS website. It's already translated it started in English, then in French, in Portuguese, Spanish, and we have also Italian soon and Japanese. We are under translation and we expect more translation among the members. So thank you for your attention. I'm sorry, I went a little beyond my time that was allocated. I want now to introduce you the speakers of this webinar. I'll just give their name at the moment. First, we shall have Angelica Espinosa Miranda from Brazil, from University of Espírito Santo. Then we shall have as next speaker Denise Medico, which is between Canada and Switzerland, who is a clinical sexologist. Then we shall have Esther Corona, the new vice president of WAS, speaking about education. And last but not least, we shall have Bobby Islam Sharful Khan, speaking about the question of HIV. So now it's my pleasure to introduce Angelica Miranda Espinosa from Brazil. We know for many years, she used to be a stagiaire at the INSERM in Paris more than many years ago. And we remained in contact, and she's doing a great career. She's a board certified obstetrics and gynecology. She holds the position of full professor at the Department of Social Medicine at the Federal University of Espírito Santo, Brazil. For 5 years, she served at the Secretariat of Health Surveillance and Environment at the Brazilian Ministry of Health. She was a national coordinator of the STI program and as a director of program in that Ministry of Health. Presently, she is a member at the PAHO, Pan American Health Organization, Validation Committee, and the WHO Global Validation Advisory Committee for elimination of mother-to-child transmission of HIV, syphilis, and hepatitis B, supporting countries to implement and monitor strategies to achieve validation targets. Angelica is very active. She has accepted to speak today with us, even if she is not in Brazil. She is in Paraguay doing a training for health professionals. Thank you. Welcome, Angelica.
Thank you, Alain. It's a pleasure to be here with you and to be able to celebrate the World Sexual Day. Today, I will share with you some perspectives of the inequalities in sexual and reproductive health in Brazil, and how these inequalities reflect the challenge in achieving justice and equity in health. I have some problem to change the slide, but Brazil has several public policies for women, including for violence prevention. And here I would like to note that we have the Maria da Penha law, that it's a federal law which provides comprehensive measures against domestic violence. But we also have policies for work and economic autonomy, for education and training, for expanding rights and citizenship. But in our moment, we have a very important policy for national comprehensive women's health care. And this policy have a very important one, to change the situation of women's health in Brazil. And now we have the first one in 2004, and it has been updated in 2011 and most recently in 2023. The policy focus goes beyond maternal care, but aims to guarantee comprehensive health for women throughout their lives. I need to say that despite these advances on paper, the implementation remains uneven, and many women, especially the most vulnerable ones, still face difficulties accessing the full benefits of this policy. And saying that, I would like to note that I'm talking about a country with almost 240 million people, and it's a very diverse country, and it's divided in 5 geographical regions and 26 states and the federal district, but it's a very different country. We used to say that we have different countries inside the same country because we have a lot of disparities. And the main change that we have in Brazil is guaranteeing equal access to health services. We have a very strong health system, the SUS, because it's a public health system, and it has been very important for us for exchanging the access. It's based in universality, equity, and decentralization, and very important to have a community participation. The SUS is important, however, despite we say that it has a universal coverage, we still see a lot of disparities. And it depends where you are to have an access timely and high quality and respectful care in the country. And this undermines both national and state policy health goals. We have in Brazil a Ministry of Women, but Ministry of Health is the responsible for design and implementation of women's health policies, all the guidelines and the strategic projects to support surveillance, prevention, and care policies. Inequalities in sexual and reproductive health are strongly tied in Brazil to social determinants, mainly socioeconomic status, education, race, and geography. Poor, less educated, and Black people face higher barriers to service, which makes these inequalities unjust and undermine our ability to achieve national public health goals. In the next slides, I'm going to approach the determinants associated with these inequalities in my country. In Brazil, where we used to say that where you live defines the care you receive. Specialized clinics and training professionals are more concentrated in the South and Southeast region, while rural and remote regions, especially in the North and the Northeast, face a shortage of resources. These geographic gaps delay diagnosis and treatment and worsen the outcomes in health. And it's a huge problem that we keep trying to fix it in our country. The socioeconomic status remains one of the strongest determinants of sexual health in Brazil. Low-income women and adolescents experience higher rates of unintended pregnancy, maternal mortality, and face barriers to contraception, abortion care, and sexual transmitted infection prevention. I need to say that abortion is very restricted in Brazil. We only have 3 situations that it's allowed: the risk of the woman's life, sexual violence, and anencephaly. All the others is prohibited. And we have been working in education and income because we think that they are decisive to reducing these disparities in our country. Another issue that we have is the racial inequalities. Racial disparities are shrinking in Brazil. Black and indigenous women face more delays in antenatal care, poor quality of services, and higher maternal mortality rates. Indigenous and Quilombola communities, Quilombola are the slaves' descendants, and they have separate communities. They also face cultural and discriminatory barriers. This outcome reflects both structural racism and the lack of targeted outreach, and we need to work on it. And I could not miss talking about domestic and gender-based violence in Brazil. Gender-based violence has been a major health issue in my country. In the past year, more than 1 in 3 women report experience violence. The feminicide, that you will die because you are a woman, is very frequent, and you can see that the numbers are increasing. Although all the new laws that have been created to hold perpetrators accountable, the problem requires broader approach, including policy to support women's economic autonomy and protect those most at risk. It's a very sad situation. And I also would like to talk about adolescents because they face a particular vulnerability in the process of learning about gender, reproduction, contraception, and youth relations. Early pregnancies, unsafe abortion, limited access to contraception, and the barriers to comprehensive sexual education contribute to inequalities in this group in Brazil, with long-term impacts on health and social opportunities. The public health system, the SUS, has many challenges to approach the whole situation and needs to have partnership with other sectors of the government, civil society, and the scientific society. And one of the partnerships that better works is with the education, because we need to implement the implementation of actions to do it together. And I would like to cite an example that is the program of health in schools. It's a very good program that has been launched many years ago, but still today it's a very good project. And it approach the health and the sexual education in schools and teach adolescents about all the questions related to sexual health. And it's important to point out the vulnerable groups. Sexual workers, people living with HIV, and LGBTQI+, often face stigma and discrimination in health services. As a result of it, some avoid seeking care, which reduces opportunity for prevention and early intervention. Services are often not adapted to their needs, limiting access to essential tools like PrEP, condom, and STI testing. In the figure here, we can see that white and high educated MSM are the ones who has more access to PrEP in Brazil. There it's another disparity because the trans women have several barriers to access the service and they still live in a kind of invisibility. And to close, I brought some different inequality example to tell you that for achieving equity in sexual health, but in a universal way, because we need to have a healthy coverage as a whole, but our health system is not enough. We need to target new strategies for those most left behind, and the intersectional policies, community-led approach, and the culturally competent stigma-free care need to be on, because they are the foundation for ensuring health for all. And I would like to finish my presentation as we are celebrating the Sexual Health Day. We recognize in Brazil that we have been through a lot and a lot of things have been done, but much work still remains. And I would like to close with a phrase that I saw in São Paulo's Visual Art Museum, that they applied, that it was ex-President Barack Obama, that change will not come if we wait for some other person or if we wait for some other time. And I can say that the people who need to act are us, and the time is now. Thank you for the opportunity to be here with you. I finish here, Alan.
Thank you, Angelica. Thank you. I'm very happy of your talk because it looks, I mean, we did not discuss it in detail before, but I'm happy to see that we are on the same lines and the topic, and it is important to see the topic that you are developing, and we learn from topics that we did not identify in the work on sexual justice. So thank you, Angelica. Question will be at the end of the program. I want to introduce now Denise Medico. Denise is also an old friend. She was the one who tried to include me in WAS and WHO very long time ago, which was not a very successful project, but then, you know, we developed more work. Denise is PhD. She's a registered psychologist and sexologist in Canada and Switzerland. Her research activities aim to promote affirmative and reflective clinical practice. Her work is informed by a phenomenological, critical, and systemic approach and pertains to issues of gender, embodiment, eroticism, and psychosexual therapy. She is the clinical director of a new Center 3 in Lausanne, Switzerland. And Denise share with us more on the topic of sexual justice and clinical sexology. So it isn't, we have, Angelica was speaking on the public health level, and now we are shifting not only from Brazil to Switzerland and Canada, but also to a different level of implementation of sexual justice, which is the core of clinical practice. Please, Denise, and thank you for accepting our invitation.
Thank you, Alain. Thank you all the WAS community for inviting me. Happy World Health Sexual Day. I would like to start with a sentence that my colleague Lynn Berkeley just said a few minutes before. I found it so lovely and exactly what I meant. She said to us, it's not a day, it's a movement. And with my presentation, I would like to present one part of the movement. I'm not talking about special population or special area of the world. Of course, I'm talking from a very North, rich countries point of view. But I would like to think with you on how issues of sexual justice are linked and can be more used in our practice of the psychotherapy and the psychosocial therapy. Psychosexual therapy is a place where sexual health and mental health collude. Working in northern country, what we are seeing these days is that a very big increase of anxiety in the population, especially in teens and young adults, more and more difficulties with sexuality, with expression of gender. And this is some of the issues I want to talk to you. In this presentation, I would like to there are three very important topics. Why do we need a sexual justice in psychosexual therapy? Is therapy a political stance, a place where we can be politically involved, and how to foster this sexual justice framework in therapy? Just to remind, we have a very long tradition in psychotherapy that promotes a point of view of the therapist being neutral. More than a reality, it's a myth, and this myth is being dismissed from now more than 50 years, talking that neutrality is not possible because we are all situated. As a person working, I have a color, I have a story, I have the way I present myself, and also my passion. So how to introduce the idea that therapy is a situated process. Psychosexual therapy works mainly with the subjectivity, sexual subjectivity, and what it is. Sexual subjectivity is the way I am embodied, the way I feel my body, the way I have emotion, which kind of emotion, how do I express them. It also encompasses the idea of gender, which gender do I feel that I belong to? How much do I agree with the gender I have been assigned to? It also encompasses my emotional and psychosocial social and relational needs. Do I need to express, how do I express my needs for love, for being confident, etc.? It encompasses also sexual orientation. Do I identify myself as being homosexual, heterosexual, pansexual, asexual? And another part also, which I would call the erotic orientation, which is what is my main interest in sexuality. And so we have also a very big domain of critics of the way we built our diagnosis, which are mainly based on a very heterosexual and reproductive framework that is moving to a more, with thank you to WHO and ICD, to a more view based on consent. But still, what eroticism is for a person is understudied now. Subjectivity, so, is a situated concept. It's a social-political concept. It is rooted in embodied experience and constructed to life event and is developmental. So, as psychosexual therapists, we should reflect on the nature of the personal. I give you a very simple example. When we work with people having had some traumas like rape, we usually work mainly on a personal level, how the trauma is processed, how do you experience it, how do you have the idea of shame, the idea of dissociation that we all know. But rape is also a systemic tool to control women and affirm or confirm masculinity through domination. And having this in mind and also working with clients to change the idea of that the personal is also something situated can be a very strong tool in therapy. This is based on a very common idea for social researcher that is not enough implemented in psychotherapy studies. It's the idea of oppression and the idea that oppression are intersectional. The oppression are intersectional and they are also they are constructed throughout life, and they are, when you are situated in an area that makes you very far from the power, where you're very marginalized, you construct your sense of yourself. So it's a developmental process. It can be also through trauma experiences, working with people having many vulnerabilities. It's very rare that I don't have trauma experiences in the day-to-day clinic. It's also learned through education and socialization, and it's also lived and encoded through embodiment and emotion. So oppression are not something external to the individual. It's something at the very core of the building of the sense of oneself. So it's at the very core of the psychotherapy. So what can we do to foster sexual justice in psychotherapy and psychosexual work? Move out from the idea of neutrality and favor the idea that the therapist should be committed to his clients and their needs. Build also safe spaces and tell it. We have to be more sensitive and culturally informed. Build safe space for queer, gender diverse person, gender erotic diverse person, relational diverse person, men, kids, then being trauma informed, because working with people having some vulnerabilities inevitably ends up in trauma work. Having some ideas what affirmative is. To be affirmative is to first recognize oppression and validate the feeling, that also may sometimes explain that some ideas are not of the person, they are inevitable in a context such as so many injustices. Explore also the issues of shame, pain, and complexity, and foster connection to oneself. And I would like to present a concept which comes from a feminist scholar, the concept of sexual agency. I think it's a concept very important for psychosexual work that can be of a very great interest. Instead of, we use the concept of being of sexual health or maturity. Sexual agency as a very important perspective is that it encompasses the idea of intersectionality. And I will just give you the definition given by Abby Wilkerson, which is a scholar working in feminist and anti-validist perspective. I understand sexual agency not merely as the capacity to choose, engage in, or refuse sex acts, but as a more profound good, which is in many ways socially based, involving not only a sense of oneself as a sexual being, but also a larger social dimension in which others recognize and respect one's identity. If we follow Wilkerson's idea, we should work with the person to come to the concretization of the idea that this profound good can be developed. But we also have to be engaged in a more social work. So being a therapist which is politically engaged has two grounds, one in a day-to-day practice and the other in a commitment to a social idea and to this wonderful idea of sexual justice that is being developing from 1 year now, and which is a very, very important base for intervention now that we are in a very dark ages of and where inequality is being perceived as more and more normal. With this idea of sexual agency can be operationalized for the work in different levels of intervention. The first level of being sexual agentive is, of course, being aware of what you feel and of your body and sensation, and because you cannot being sexually agentive if you have no idea what you feel, and if you cannot sense if a thing is good for you or bad for you. And for those who are psychotherapists listening to us, we all know that trauma can cause dissociation, and dissociation will cause a very, very poor ability to be aware of what you feel. So a very poor ability to be sexually agentive. So we have to develop this capacity of feeling. And as we know, many things in our lives and in our systems can affect this feeling. Sexual subjectivity then is knowing oneself's needs and desire, which is an exploration process to know who you are as a complex person, and what are your desire. Then we go to this how to connect with oneself. Then we have to develop the capacity for affirmation and consent is a very complicated concept. Well, I have not the time now to discuss all that more profoundly, but it's a concept that is evolving and that is not only a legal concept, it's also a living concept. We have to foster intimacy, communication, and hopefully develop the capacity to be open to other and to give meaning to our sexuality, which is also something that could be very important for the integration of a sexual health and sexual justice perspective. Thank you, and I will respond to your question after.
Thank you, Denise, for this very interesting and detailed theoretical proposal for enhancing and including justice in the core, in the nucleus of the clinical practice. It's now my pleasure and honor, I would say, to introduce our next speaker, Esther Vargas from Mexico. Esther is also, among other things, a friend. We met in UAS many years ago. I forgot how many, since there are so many. She's based in Mexico City. She's a leading figure in sexuality education and sexual rights advocacy. She has been a long-standing member and current executive committee member and vice president of the WAS, and she serves as vice chair of the Sexuality Education Committee, and last but not least, as co-chair of the Sexual Justice Initiative. This project was a joint venture, and the last 4 years, I don't remember how many phone calls and Zoom meeting we have to coin, the declaration on justice. Another aspect of justice in justice is the question of how can education address, repair youth sexual health and sexual rights injustice. Please, Esther, go ahead.
Thank you very much, and thank you for the introduction. And to everyone, everywhere, very happy Sexual Health Day. which we are celebrating from Porto, where we will have tomorrow the sexual health assembly. So it's really a great honor, and I feel so enriched by the fact that we are discussing precisely today sexual justice and what can we do. And within that framework, we're going to start just by asking ourselves, what can education do? Education both as an action, but also as a system. Education, of course, is not only confirmed or confined to within schools. Sometimes some people think that when you're speaking about education, you're only talking about in school. But as we are going to see, in sexual justice, in this framework, it relates particularly with all those that have been left behind and are in the out of school system. Can we have the first one, please? So I just want to, this presentation endeavors to investigate what are the challenges of out of school youth, and also briefly to propose some strategies to bring sexual justice into play with the whole educational perspective. Next one, please. We all agree that sexual justice is must remind ourselves, is a dimension of social justice, as well as the possibility of having access to some kind of educational structure within society. So it has to do with rights and dignity, and education itself is fundamental for bodily autonomy and personal agency, as we know through research. And of course, equitable access of all the system, of all the resources that are in place in educational systems. And also, very often it's tied to structural reform, and that particularly has been addressed through, in many countries, through what do we do not to perpetuate discrimination and exclusion, which sometimes are embedded in the educational systems themselves. So within this big framework of social justice and sexual justice, which has just been talked about through specific points of view in public health in Brazil, in psychotherapy, and of course with the broader umbrella that Alain Giami presented, we need to say why. Why is it important for education to address it? Next one, please. And we know that comprehensive sexuality education, not only the big, broader concept of education, but sexuality education is a pillar of justice because it brings knowledge, it brings protection, it brings inclusion, particularly inclusion and agency. This is something that has to be worked in through how we carry out comprehensive sexuality education and whether it is available to all children and all young people and everyone within a given population. Education itself it's absolutely vital for marginalized groups, particularly young people with disabilities, people with have issues with their body, or people that have problems, or not even problems, but issues with gender orientation, gender, sexual orientation, and also intersecting with violence, what is happening, how it ties to education. The next one, please. So, next one. Particularly when we are looking at this perspective, I'm not talking so much about what goes in school, although we could have a whole webinar talking about in school and what the school systems does or does not to promote sexual justice, to promote sexual health. But in our framework, this framework of sexual justice that looks particularly at injustices, at marginalized people, marginalized communities, we find that it matches perfectly well with out-of-school youth. Today, we have 251 million people out of school. These are people who have not been able to get into the system for many reasons that we know now. It has to do with social injustice, inequalities, intersectional poverty, conflict situations, disability, many of the issues that have been touched in previous interventions. So it's very difficult to define the number of people that are out of school and why, because and the age range that we are talking about is from 5 to 24, but it affects people beyond these boundaries. It affects young adults and it affects older people as well. But very often the most vulnerable populations, young populations, aren't represented in databases. They're completely lost. They are precisely part of this ghost population, and that we really don't know what it happens with them. So that makes it more difficult to reach globally. Maybe they have never enrolled schools, or maybe they drop out. Walking distance to schools, not being able to pay for tuition, not being able to pay for uniforms or materials, financial constraints. In other places, like unfortunately, we still have lots of young people and children being part of the labor force, and of course, early marriage, which cuts completely a very large number of young women from the possibility of continuing their education. So these are also linked, as also our Angelica and Denise have shown, to ethnicity, to migration status, which is right now one of our biggest challenges, traffic, and of course gender and gender situations, or having to do with biases and norms. Next one, please. So what are the examples, just examples, none of them, of these marginalized populations, girls and young women, due to political circumstances? I mean, we could name countries, we could name communities, and we have seen through a pandemic how these young women and girls were often the caretakers of their whole community within the difficulties that we experienced during the COVID pandemic. And also, of course, tied to gender-based violence. Humanitarian settings. What to say right now, where we have so many places in the world facing conflicts, particularly young women and young people and girls are affected by the lack of access to service, not to speak even of the possibility of attending schools. That sometimes is out of place, or even things like access to water, access to food. So those are some of the in humanitarian settings that completely exclude young people. Disabilities. We know a lot more, much more of the physical barriers and all kinds of barriers for all kinds of disabilities, but yet we are far from reaching a situation where they can be really addressed. I have not even touched about LGBTQ and people indigenous youth, which are great populations in some of our countries, and youth living with HIV. So these are the groups that are facing most marginalized, and they tie precisely with the groups that we in the Sexual Justice Initiative are trying to work with, not work for, but work with, in trying to find out exactly how these systemic inequalities can be addressed, and what are the kind of things, as we say in today's World Sexual Health Day, what can we do? Next one. So very briefly, what can we do from the educational system as a whole, not only of the educational system, as I say, in school or ministries, but the whole how society goes about educating, from very informal education within families to what is done in other areas at other times. So first of all, we have to recognize intersecting oppressions. We have to acknowledge that racism, ableism, heteronormative, and other systems create the barriers for the individuals and for communities. We have to insist on reforming curricula and policies. Curricula both at school level and out of school needs to face and needs to address and needs to be aware that these differences exist and not create a suit fit for all, but think about, at the same time, devising the policies that can reach whole communities. At the same time, how can they be tailored to specific needs? We have to center on marginalized voices. We have to work with all these people and help them and make them part of the decision processes themselves. Very often now it is said that young people should be part of creating the educational system itself, but it's sometimes only young people who are able to be or to fit within certain parameters of a system, and not all those that we are talking about. I mean, who thinks about young workers, young people involved in commercial sex? Who thinks about right now what is the impact of all our digital technology? How even how artificial intelligence is impacting our young people, because those are sometimes the ones that are being reached through and targeted through the media, this kind of digital media, these kind of people who do not have access to more organized or systematic ways of educating themselves. So we have to insist also that institutions have to be transformed, and we have to move beyond these individual interventions precisely to address all these systemic barriers. This is very complex because that means a very high level of interaction between all the kinds of systems that make our society. But that's the only way if we are going to move forward and we are going to address the backlash that we are undergoing today, that's the only way we can move forward. Next one, please.
Esther, you need to summarize.
I will summarize. So the path forward is to think about comprehensive sexuality education in maybe a few important changes. How to expand strategies, how to adopt, as we have said, intersectional frameworks, and how we institutionalize structural change. And to me, this is one of the some of the strategies that we can do to precisely answer this question: what can we do? Thank you.
Thank you, Esther. Thank you for this very, very comprehensive intervention. And what I want to emphasize is the importance of out-of-school education, because school is already a place of inequalities, of inequities, because not everybody has access to school. So it is important to think about society, the places where many young who are excluded from school and need to be accessed. Thank you, Esther. Another dimension in sexual justice, which is a political and global dimension, and I'm happy that you mentioned in particular the question of the threat of implementation of sexual health services with the reduction of USAID program, and show the importance of mass crowds, violence against in individual. What I want to say is that I think we have a lot to develop, a lot to say, and this for sure, this is not the last event that we are going to organize on sexual justice, and I'm sure that we are going to continue. When Bobby says that WAS should develop, organize communities, I think it's your turn to work, Bobby, to continue to develop your work as a member of the WAS advisory committee, and please go ahead. It's your turn to do it. You are more than welcome to develop this kind of dimension. Among the questions that were mentioned in the question and Q&A discussion, someone commented on the fact that we didn't speak of people living with disabilities, and but I think today first, what we realized in the work of the steering committee of the sexual justice is that it is impossible to list every situation of injustice. Unfortunately, there are too many situations, and it's difficult it's impossible to have a full. But then about the question of abilities, disabilities, these situations are absolutely mentioned in the position paper that we are developing, and I wish to thank you to have reminded us to include this issue. I want to thank now every speaker who dedicated time and energy and intellectual work to proceed with this project, and I'm sure that this webinar will be one step into the future development and implementation of sexual justice program, and that we shall try to build a network, of communities, out of the voice, to be able to speak. Maybe René will say the last word.
Thank you very much, Alain. And thank you to everyone who joined us from all over the world. We are so grateful for you giving us your time. We know in some places in the world it was very early in the morning, and for others it's on other times. That is the fortune and the misfortune of working globally. For some people it's always uncomfortable time, but today we have so much happening for World Sexual Health Day. Please help us to spread the word. Please go and follow us on social media and use the hashtags Sexual Justice and World Sexual Health Day 2025. And if at all possible, please join us for all the events taking place today. Have a wonderful World Sexual Health Day. And remember to please do something today that gives you pleasure. Enjoy your day.